Welcome to The Steward, MSD's podcast dedicated to exploring the critical fields of antimicrobial stewardship and infection control. I'm your host, Holly Smith, from the Policy and Communications team at MSD in the UK. Through the series, we'll engage with a diverse range of experts to discuss their insights and experiences with antimicrobial resistance and how this can be translated into effective antimicrobial stewardship across the UK. As a reminder, all contributions by experts, their comments, factual claims or otherwise, are based on their own experiences and have not been influenced by MSD, nor do they represent the views of MSD. Now, let's get started. In today's episode, we'll be exploring the pivotal role of vaccines in the battle against antimicrobial resistance, or AMR, including how vaccines can not only protect individuals from infections, but how they also might help minimise the reliance on antibiotics and risk of resistance down the line. We have the privilege to be joined by Dr Catrin Moore, a microbiologist based at City St George's University of London. She is also a member of the World Health Organization Advisory Group on Critically Important Antimicrobials for Human Medicine, a mentor for the Fleming Fund Fellows based in Eswatini, and a co-chair for the Impact and Influence Committee for the Microbiology Society. Thank you so much for making the time to speak with us today, and welcome, Catrin.
Thank you for inviting me, Holly.
So to kick things off, I've been asking our guests similar questions. And so I guess firstly, would you be able to share a little bit more about what brought you into the AMR space, please?
So I have to go back many years when I think about that. I started off in the diagnostic microbiology lab in Oxford, in the John Radcliffe Hospital, where I was obviously diagnosing infections and seeing people, how they were treated, those who got better, those who had blood infections, etc. And then I decided that I was really interested in the research that I was doing during my master's project. My master's project was on coagulase negative staph, and a project became available on Staph aureus for a research project. So I thought, that sounds really exciting. And the big bonus for me there was that the project was based both in Oxford and in Thailand. So I got to travel as well. So I got to travel and see how different cultures were, see the different infections, how they affected people in different ways. And that was just such an eye-opener. I was hooked from then, really.
Amazing. Thinking about this podcast and the role of vaccines in the battle against AMR, I think firstly we need to think about vaccines and vaccination really in general. So, you know, vaccines have a long history. They date back to the 18th century with Edward Jenner, who I learned all about at school growing up in Gloucestershire, where he also was from. He obviously developed the first smallpox vaccine that was successful. And since vaccines have become one of the most effective public health interventions, preventing various communicable diseases that were previously life-threatening. If we go right back to the start, can you explain a little about the role of vaccines, or how AMR might benefit with the support of vaccines?
Yeah, so a vaccine is a preventative measure, which, you know, if you don't get an infection, that's where you really want to be. You can reduce secondary infections. For example, if you got an infection with flu, sometimes you might get a secondary infection with a bacterial infection such as Streptococcus pneumoniae, and you can reduce that if you already have the vaccine and you have the immunity to that bacterial infection. There's also, if you vaccinate a whole community or a whole population, then you have herd immunity. So even if a percentage of that population is vaccinated, there's immunity for the other population, because this susceptible population, the smaller population, don't have the infection, so they can't pass it on. And the other positive with vaccines is that you're using less antibiotics to treat infections because you don't have infections in the first place. So there are four really good reasons for having a vaccine against a bacteria.
Brilliant. And ultimately, all of those examples you just gave lead to less antibiotic use, which means there's less selective pressures and means that resistance should hopefully slow down, and we won't see quite as much resistance.
Yeah, no, absolutely. And additionally, you don't get the problems that you have sometimes after you take antibiotics, the fungal infections and other tummy upsets and things that you would normally have. They don't occur because you're not taking the antibiotics. You don't need them.
Mm-hmm.
And there's a misuse of antibiotics as well because they're just not needed. So we can start to be very careful of the amount of antibiotics that we use then and only use them when they're necessary.
Brilliant, thank you. Catrin, in terms of vaccination strategies that exist within various communities, be that in the UK or globally, can you speak to some of the community-wide benefits of vaccination that we see?
Yeah, can I first say that I'm sitting in the Jenner Institute?
Amazing.
Because he came to St George's as a doctor. So there is a long history of vaccines and infectious diseases here in City St George's, for a start. But how have vaccines changed communities? So you can think overall, there's a vaccine program that I can think of that really has reduced the burden and the prevalence of infectious diseases, and that would be the pneumococcal vaccine program, which has been rolled out globally and really has reduced the mortality due to strep pneumoniae. That is always that you think of as being the best one that you can come up with. There are other vaccine strategies like TB and others, but they've never quite got to the same level of protecting people as the pneumococcal program has. But that's where we want to be with many other bacterial vaccines, really, given the amount of resistance that we have in the different bacteria nowadays.
Exactly. And I think what's relevant there as well is how strep pneumonia is being designated a priority pathogen by the WHO, which is obviously where we would like vaccines to continue to be developed and to help to prevent.
Yeah, there was an update in the priority pathogen list last year, which really, it prioritised TB for one, which hasn't been on the list for a while, or hasn't been on the list, and Enterobacteriales, which are some of the most prevalent bacteria with a high mortality and morbidity, such as Klebsiella pneumoniae, which causes lots of infections and mortality in neonates globally. And if we had a vaccine against that bacteria in particular, we could really save thousands of children. So there's a study that looked at healthcare associated infections in Klebsiella pneumoniae, and actually said that if there was a vaccine that had 70% efficacy, so it worked well in 70% of cases, that they would avert nearly 80,000 deaths globally per year. So that would be 3.4% of neonatal deaths that would be averted by a vaccine against one bacteria. And the other thing, I guess, is that vaccines don't just cover resistant bacteria. They would prevent infections with sensitive bacteria as well as resistant bacteria. And that's what makes them a great tool.
So when we were speaking before, Catrin, you mentioned an example of how vaccines can prevent infections, particularly in neonates. Are you happy to share that with the audience?
Yeah, of course I can. So I've already mentioned Streptococcus pneumonia, which has been an excellent example, but also the World Health Organization over the last few years have been looking at vaccines for bacterial pathogens and trying to prioritize those. And they've come up with 16 priority bacteria, and they've asked, or they've written 16 papers about vaccine value profiles. I was fortunate enough to be part of the team writing about Klebsiella pneumoniae vaccines, and that's one of the target areas that that the the World Health Organization and funders have at the moment. And the reason is that so many neonates die because of Klebsiella pneumoniae infections during the first few days of life. So that if you could vaccinate the mums, that then protects the children, the babies, then that would be the perfect scenario. So there are a lot of researchers looking at this and trying to prioritize this to have really good vaccines against Klebsiella pneumoniae. There is a push at the moment. I think there are certainly some vaccines coming through within that pipeline that, you know, hopefully in the near future, we will have good vaccines for that. I should also say that the same is true for Group B strep, so Group B streptococci, where they want to do the same, to vaccinate the mothers to protect the children. But I think that's a little bit further behind in the process.
Thanks, Catrin. And it's fascinating, isn't it, how there's WHO, but also other organisations. There's a huge amount of organisations now that are really looking into the area of vaccines and AMR. How effectively would you say vaccines are used as a preventative approach in the fight against AMR right now? And do you see that maybe increasing in the future?
That's a really good question. Because if you think about some of the bacteria that are the most resistant bacteria, the most hard to treat bacteria, there are no vaccines at the moment. So it really needs a big push and a lot of money going into this to prioritize those bacteria, to have research, to have vaccines in the pipeline. I mean, you could also say those are gram-negative bacteria that are being looked at, but also some of the bacteria. So gram-positive Staphylococcus aureus has killed many thousands of people over the last 20, 30 plus years. There is no vaccine as yet, no successful vaccine against Staph aureus, and equally, that should be prioritized as well. There's one major strain of Staph aureus which people may have heard of, which is MRSA. And if you have no vaccine against that, lots of people will die with MRSA in the community as well as in hospital. And that's sort of particularly prevalent in countries such as Australia and America, where there are high levels of resistance in those countries.
And so in those countries, but also maybe thinking about this from a bit of with a UK lens as well, with our newer government. I don't know if we can call them new anymore. What would you say that our kind of policymakers, but even maybe the wider general public, need to do to really increase that level of awareness in the role of vaccines?
Yeah, so I really don't think that the general public per se, even, you know, my family and things, really understand how a vaccine can prevent infections, bacterial infections particularly, and how that would benefit themselves and other people, how that would mean they don't need to take antibiotics, they won't get infections with these bacteria. I think there needs to be a lot more awareness around this. And actually, last year we were running workshops within the microbiology society called Knocking Out AMR, where we were holding workshops around this to understand how vaccines can help in the policy area. I really don't think people understand how good vaccines are preventatively. You know, we tend to think of vaccines being given just to people who are susceptible, or just to the older or the younger generation. But actually, it could really prevent infections across the board. As we get older in our communities, these vaccines, I think, will become more important in reducing mortality and morbidity in our populations, particularly where older people have more comorbidities as well.
And I guess older people as well. I know I've seen various statistics, and it always kind of shows that older populations are generally those people who do get antimicrobial resistant infections, and that's where the biggest burden of those infections tends to lie too.
Yeah, partly because the older population tend to be going into hospital more, and so they come into contact more with resistant bacteria. So if they had a layer of protection, that would really help.
And perhaps a hard question and a bit mean of me to ask, Catrin, but what do you think we could do to increase public awareness around the understanding the role of vaccines in preventing the spread of AMR, or even just infections, maybe more in general?
So there's a lot of disinformation around. I think we need to stop the disinformation, and I will come back to you with things that are not easy to implement, let's say. So we've got to stop that disinformation. We've got to stop people saying that the vaccines don't work, that they won't cure, that they won't prevent disease, because they do. Vaccines, we have to have more evidence to show that vaccines work, I guess. I think that's the answer. But that evidence needs to be expanded outside the scientific community to the general population. And we need to have maybe nurses, doctors, dentists talking about vaccines being the way to prevent infections. And that antibiotics may be a magic pill at the moment. And I might argue that actually that effectiveness is already decreased somewhat, but they won't be there in the future. And so we've got to stop relying on antibiotics, and we need something else. And a vaccine can take that place and will take that place.
Wonderful, thank you.
Yeah, just thinking further, I think we need the politicians to be behind it. We really need the politicians to understand how important this is. And that's beyond vaccines, beyond AMR, but bacterial infections, that we can't just brush it under the carpet anymore.
And that's really, I would say, governments also across the world, or politicians across the world, because resistance and infections more generally know no bounds. We saw how quickly the COVID virus spread, for example, from country to country. And you could imagine something very similar happening with some, a future infection that could pop up.
Yeah, no, absolutely. And part of the problem that we have is that we have a lack of diagnostic tests to actually recognize that. There could be an outbreak of a particularly resistant bacteria, and we wouldn't know because we don't diagnose it. We don't have a test to do that, both often here in the UK, but also elsewhere globally. So we need that diagnostic test to say what the bacterium is, and then to say how resistant it is. So that's part of our arsenal as well. But all of this needs that governmental support to put policies in place and put money behind it as well. And you have, I think, the top-down and the bottom-up approach to say how important these things are. I mean, last year we had the United Nations high-level meeting who really supported this, who said we should have diagnostics in place, we should be using a certain group of antibiotics, the first group of antibiotics called the access group of antibiotics, more than we do the second group of antibiotics, so the watch antibiotics. And they've pledged $100 million, I think it's $100 million to support this. It's not enough, but it's a start. And we need this. So that's your high level, this is what's happening. But you do need that bottom-up approach as well. And you need each country to own this. Part of it is understanding the economic side of this. How much, if we have vaccines in place, if we have diagnostics in place and good antimicrobial stewardship, how much will that save people? How much will that save the government? And how much going forwards, so we can project that rather than just today. And the government then needs to have a longer term strategy, just not to say just these 4 years, these 5 years, has to be much longer than that. I mean, I would say that we are seeing some of that in our government at the moment, and hopefully they will bring that into our field as well.
How do we currently recognise the value of preventing antimicrobial resistance when it comes to assessing vaccines, be that in the UK or internationally? And perhaps a follow-on to that, whilst I'm still talking, is there anything that we should consider changing?
I think that's a good question. I think we undervalue it. Often most of our evaluation with vaccines is economic. So we go back to the health benefits as well. So it's not just the cost of a vaccine and the cost of care, but it becomes a whole picture where you don't get secondary infections, you don't get sequelae, so you're not sick for a long time and your health is much better, you can go back to work, and that whole picture, if I'm thinking, you know, on a personal level rather than on the policy level. Also, I mean, taking that a step further, if you think about a patient who gets meningitis, they're often sick for many, many months. They have sequelae where actually they never really get over the infection. But a vaccine can stop all of that. You know, you then don't have the infection, and you would never have the infection. So there's no problem at all then. So it's, I guess, in a way, a lot of groups model this, and I think you have on the governmental side, they have to really look at those models and really understand the benefit of the vaccines that way. Mm-hmm. And within that, they have to look at maybe sensitive infections and resistant infections. That would then come down to the prevalence of resistance in the country. In the UK, it might be quite low because we have mostly sensitive infections, but in other countries, it might be high because they're really resistant infections. I mean, they've seen this in some of the countries, like I'm trying to remember the countries now, but a couple of countries where they've introduced the Salmonella vaccine, and that vaccine really has reduced the prevalence of disease and resistance in those countries and been extremely successful. So I think there are models from other countries that we could think about in the UK there.
Brilliant. That's it. And I guess it's about quantifying. You say it's difficult, but it's about trying to quantify the wider societal benefits also, by the sounds of what you're saying.
Yeah, so that's some of the work that the Global Burden of Disease studies do. They look at the quality of life. And that's the whole thing, isn't it? It's not just people who don't die, but it's the quality of life of people who get an infection, but still their quality of life is less because of it. If you can stop that, if you can stop people being in hospital beds for weeks, if not months at a time, then, you know, it's all going to be positive, isn't it? But what you do need to do is put some money in that first step to get the prevention, and focus on prevention as well, not just cure, but focus on prevention before people get infected.
And actually coming on to that, and maybe those kind of 5-year strategies or 4-year strategies that you're talking about. So last year, 2024, we saw the renewed National Action Plan against or for antimicrobial resistance released. That is going to run from 2024 all the way to 2029. And actually within that document, there is a specific call out around investing in vaccine innovation in the UK, and obviously then kind of there is a layer up to think about that more globally as well. What would you say is the importance in investing in vaccine innovation here in the UK?
I think the importance is, as we have older generation, and as we get older, as a generation, as a community, as a population, then we're going to get sicker, and our quality of life is going to reduce. One way of changing that is to have some preventative measure to stop us getting quite so sick. You know, I think of my mother-in-law, who may be taking 10 drugs, who may have different comorbidities, COPD, other diabetes, other comorbidities that make them susceptible to infections. And then they're sick for weeks, if not months at a time. And if we can prevent that happening, and we can have a much more mobile, much more healthy older generation, then it impacts the whole population, doesn't it? It impacts the children, the grandchildren. The grandparents then are more accessible, more able to look after people. It just changes the whole dynamics, I think, within the population. And there is less support needed from the NHS. There's less support needed from other community health centres. That it frees up the people who really are sick, who need that. So I think it would change everything. I think as a population, we need to think more about prevention. It's the non-communicable side as well. How can we change our lifestyles to become healthier? And vaccines certainly would be part of that. I think with going back to the pneumococcal vaccines and the pneumococcal programs, the addition of pneumococcal vaccines for the older generations really changed that. There were less people getting sick from community-acquired pneumonia and things, and that really has had a knock-on effect with everyone.
And I think you described those more direct effects of prevention really clearly, the hospital care, but then actually the more indirect effects or financial impacts as well, implications of illness, of not being able to go to work because our workforce is getting older, and that our people are now working beyond retirement age, and those people are caring for, whether that's grandchildren, whether that's their own relatives. There's a lot of caring responsibilities that also count towards those indirect effects that you described really nicely.
Yeah, often I think those indirect effects are missed.
Yes.
Yeah, they're a burden on each and every one of us, but we don't think about it because that's what you do.
And most people just muddle on, right?
Indeed.
So, Catrin, we've spoken a little bit about the benefits of vaccinations. However, I know when we spoke previously, you briefly mentioned some of the challenges associated with vaccines, particularly around vaccine-induced pathogen strain replacement. Would you be able to explain to the audience what this means and maybe some of the risks that it can pose for AMR too?
Yeah, thank you. So one of the best known vaccines and production of vaccine escape or evasion is in Streptococcus pneumoniae, so the cause of community-acquired pneumonia. And the bacteria has a capsule around it, and the capsule there are many different capsules, over 100 different capsules nowadays. And a vaccine against Streptococcus pneumoniae has more than a single capsule in it, and those numbers have been increasing over time, but each time that the vaccine has more capsules in it, the efficacy of the vaccine goes down, for one thing, but also the organism is a fantastic change machine, basically. So it can change, and it can make more capsules, different capsules, that then evade the new vaccine. And what you have with some of them, the major one that's evading the vaccine at the moment is really mucus. So the capsule is really thick, really mucus and sticky, and that then helps the bacteria and the infection to evade the vaccine. So the vaccine is no longer effective. I mean, bacteria are just masters at doing this. So to make a really good vaccine, we need to cover as many of the different types of bacteria that we can.
Thank you, Catrin. Perhaps this will lead on to our closing remarks. A huge thank you for your time today. We covered a huge amount, but I think we could have talked for a very much a lot longer. To close, I've been asking all of my guests one final question, and that's what would be a key message or the key message that you'd like the audience to take away from today's discussion?
So the key message is prevention is better than cure. We all know that, but we need to really think about how we can get prevention right. AMR is here now. How can we stop it becoming a worse problem than it currently is? AMR is a huge problem that's not known about. It's absolutely huge, but we need to prevent the burden of AMR, and one of the tools that we've got, our bags, are vaccines.
Thank you for joining us today on The Steward. We hope you found this episode insightful and thought-provoking as we explored important topics surrounding antimicrobial stewardship and infection control. We'll be back soon with another episode featuring more experts and fresh insights.